procedure, and he actually just got contouring done on his stomach and his chest, and we're getting ready to tighten everything. Pull the bottom here as well as lift the nipple. We actually created more of a border here, so when we do that tightening, it's really going to give a lot of definition for him and remove any gland tissue that could be there. What I'm doing now is I'm using the plasma device to shrink any scar tissue and sort of soften and clean up any of the remaining superficial fat cells or scar tissue that maybe have been causing some irregularities for him. That's why you can actually hear, and you can see like I'm kind of pushing really hard because there's a lot of like superficial tissue. You can hear the device really superficially because it's literally contracting that tissue. If you were to actually show it on fresh tissue, you would see all the fat cells sort of shrinking and then blending into the tissue, and when done right, it really kind of evens everything out. I call it sort of the cleanup crew after the lipo. It really gives a nice result, and it's what's going to give us a more tightening result. It's also going to give us more of a contouring result. That's why this is a lot more thin than the area where the abs are. We can even do kind of on the border, but we go through the entire area, and it just takes a little bit of time. You have to be willing to, be patient and go through the tissue slowly. We don't need to go over areas we're going to remove, like down here, but we do need to go kind of all around the abs and the lower portion so that we get as much tightening as possible. What are they normally asking on there?
How long does the skin tightening last for normally?
So, especially like if you do a tuck like this, it could be 10 years plus, depending on how you're working out, diet, and exercises. So obviously, with this procedure, you can't just get this in V1 and done. You gotta work out, you gotta start peptide treatments. We do a lot of peptides post-therapy as well as massage and hyperbaric therapy to prevent any scar tissues from forming. But this can be a permanent outcome long-term if you really maintain it. The device itself can actually be done awake in the office in smaller procedures locally, but in bigger procedures like this, I tend to, unless we're doing just the front and sides, I tend to do it asleep because that's where we need to really be detailed and go along the tissue, along the muscle and under the tissue, and we don't really want to irritate someone. So we are going to go for a while, you guys. It's going to take a little bit of time. While we're doing that, they're preparing the fat's being purified. We're going to use that for his penis as well as other areas to really give him nice shaping. And then that's it. We're going to even do his calves today. So make sure you follow along, and we will show you the final result very soon.